All right, and as she had mentioned, my name is Tiffani Dilworth. I do want to thank again you for that beautiful introduction. Like she said, I'm a licensed clinical professional counselor and a certified advanced grief counseling specialist. And again, look at my bio for the books that I've published as well. I definitely want to say thank you so much for Western Tidewater and Region 5 for this opportunity to present this information. And so for today, we are going to have 2 breaks, one in the morning, one in the afternoon, and we're going to have a lunch break as well. So usually when I do these presentations in person, we usually have a little basket in front of everyone where people can play with a stress ball, color pencils, bubbles even, because the topic we're going to be discussing today can be very triggering for some people, especially for an individual who may have had a recent loss. Some of the things we're going to talk about might remind you of a loss that you've experienced in the past. And so I do want to encourage you guys to have something in your space that is calming or relaxing, whether it's a candle or maybe it is a stress ball or some bubbles even. All right, so for the disclaimer, I have to read it all the time. Materials that are included in this course may include interventions and modalities that are beyond the authorized practice of mental health professionals. As a licensed professional, you are responsible for reviewing the scope of practice, including activities that are defined in law as beyond the boundaries of practice in accordance with and in compliance with your profession's standards. And so our goal for today, at the beginning of the day, we're going to focus mainly on conceptualizing grief. What does it look like and the different types of grief? And then we'll also talk about...
I'm sorry to interrupt you. I don't know if anyone else, but while you're sharing your screen, I'm only seeing a blank. I can't see your PowerPoint.
Oh, no. Okay. I'm glad you shared that with me. Let me see and figure out what's...
Okay. Maybe if
maybe I can exit out and try it again.
Yeah, maybe stop.
Okay.
Okay, I can see it now. Whatever you just exit out of right before you stop sharing, then I can see your PowerPoint.
Okay, all right. I'm glad you shared that. Let me try it again. And I love technology. I worked the other day when we did it, so. Okay. So go to screen share, PowerPoint. Okay.
There you go. Okay. Now let's see what happens when you make it big.
Beginning.
There you go. There's still a little, do you have something? Oh, whenever you actually press play to play it, it turns into like a blue screen, like something's in front of it.
Blue screen today. It's great to be here with you guys. Again, my name is Tiffani Dilworth, and you're more than welcome to take a look at my bio just regarding the different books I've published and just the different experiences that I've had with talking on different places. And so we're going to go ahead and get started, and we're going to do the disclaimer. So disclaimer is materials that are included in this course may include interventions and modalities that are beyond the authorized practice of mental health professionals. As a licensed professional, you're responsible for reviewing the scope of practice, including activities that are defined in law as beyond the boundaries of practice in accordance with and in compliance with your profession's standards. And so kind of the structure of today, at the beginning, we're going to talk more about grief and conceptualizing it. What does it look like? And then later on today, we're going to talk about actual models that you can use with your clients and some concrete tools they can use as well. So I'm going to quickly read through the learning objectives. The first is to be able to recognize and explain the different types of grief and their symptoms, to understand how the different types of grief can impact the progress of treatment, to be able to recall 3 to 5 grief models to conceptualize grief, to be able to assess which grief models may be most impactful for the clients that you're working with, to be able to list 3 to 4 different grief assessments that can help conceptualize grief and create a more holistic treatment plan for your clients, and to be able to illustrate how grief can impact across the lifespan. So we're going to talk about different age groups as well. And then also we're going to talk about understanding how culture and spirituality can impact the grieving process and our role in that as well. And the last thing we're going to focus on are the interventions. 3 to 4 interventions for grief that can better care for our clients. There's going to be a long list of interventions, but the goal is for it to be able to retain at least 3 to 4. And so first I'll talk about grief and mourning. Those are terms that are used interchangeably. And so while I'm talking about this, just so I get an idea of who's in the room, if you guys could, in the chat, let me know your role in giving people support. So again, that just gives me an idea on who's all here today, so I kind of gear things towards you guys. But while you guys are sharing that, for grief and mourning, grief is that internal experience. So it could be such as feeling angry. It could be sadness. It could be even feeling guilty. So mourning is an external expression. So let's say, for example, a child loses their parent. So inwardly, they might feel angry, they might feel confused, but outwardly, they may experience crying more often, or they may become more aggressive towards their peers. And so when it comes to grief, there's a lot of things that can cause people to experience grief. Many people, they think just of death, but there are a lot of examples. And so I'm going to ask you guys another question here in a minute, but I just want to kind of look through the chat to see who's all here. So you have some mental health supervisors, peer, okay, support specialist, group therapy, it looks like, drug court coordinator, senior clinicians. Nice, okay, great. Sounds like it's a wide variety of individuals. So it looks like some home-based individuals as well. Wonderful, great. And yes, we're gonna definitely talk about some tools for those of you who work home-based and in office, some tools that you can give to your clients who are experiencing grief. And so many times, again, like I said just a moment ago, when we experience grief, many people think of a death, but there are many different types of losses. So just for a moment in the chat, I want you to try to think, what are some other losses people might experience that might cause them to have grief at some point? Divorce, yes, definitely. Divorce can definitely cause some people to experience grief. Job loss, relocation. You know, a lot of people don't think about that, relocation, because when we live somewhere, we are accustomed to our neighbors, the culture, the environment, and then we relocate to, let's say, a different state or a different country, and the culture is different there. So we lose our friends. We may not be able to talk to our friends as much. So that separation can definitely cause people to experience grief. A natural disaster, yes. We're going to talk about traumatic grief here in a little bit, but definitely a natural disaster. Being placed in foster care, yes, definitely foster care. Not only for the child being removed from the home, but also the foster parent. The foster parent gets accustomed to the child and interacting with the child, and then the child goes back to their home or to a different support group or a different foster home. Sometimes that can be very challenging for some parents, some foster parents, and they can cause them to experience grief. Because again, grief is basically that internal expression after experiencing a loss. Thank you guys so much for sharing that. Yeah, quite a few different ones. Yes. Some more examples is retirement. Retirement can definitely cause some people to experience a loss. What about the activities of our limbs? As we get older, many times we lose activities of our limbs, or maybe someone gets into a car accident and they are now unable to walk. So that can definitely cause some people to experience a loss as well. The next one I'll talk about is acute grief. So acute grief is that earlier time period where just after the loss. So this is where a lot of intrusive thoughts are present. This is where the individual is really focused on the loss. And there's a lot of intense emotions happening at this time as well. Integrated grief is the ultimate goal. So this is where we're trying to get our clients to. So integrated grief is this place where an individual is able to function in life. They don't have as many intrusive thoughts. They don't have a preoccupation with the loss that they experienced. And they're able to find meaning. They're able to find a connection in their current life. And they get to this place of acceptance. And so when someone's experiencing integrated grief, it doesn't mean they aren't sad. It doesn't mean they don't think about their loved one. Because sometimes the holidays might pop up, or maybe an anniversary might pop up, or the death anniversary even. And so the person might get triggered by those events, by those holidays, and that's where acute grief might come back for a time period, and then they might go back to integrated grief, where they're able to go about their life and not be preoccupied with their loss. And so the last one I want to talk about in this slide is chronic grief or complicated grief. And so this is a more long-lasting form of acute grief. And so this is when the person is consistently preoccupied with the loss. And it's hard for them to process it. It's hard for them to keep moving forward in life. And so it's important for us to recognize that loss is a natural part of life. We're all going to experience loss at some time. If we haven't already, at some point we will. And so because loss is a natural part of life, so is grief. And so is mourning. And so what happens sometimes is some people get stuck in that grief and mourning place. And that's when it's considered chronic grief or complicated grief, when they get stuck in that place. And again, we're going to talk more in detail about the different types of complicated grief as well. The first one we're going to talk about is normal grief. So normal grief is kind of what it sounds like. This is the ideal trajectory. Of course, it looks different for everyone. As we're going to go through, you'll hear that. But normal grief is the ability to move towards the acceptance of loss. Is the initial intensity of emotion gradually decreases. The individual has the ability to engage in daily functioning. So they're able to get up, go to work, do daily hygiene, take care of the family, pay bills, interact with friends. And in this place, it's about us normalizing this experience for our clients, the people that we're working with, the homes that we're going into. It's important that we normalize the experience that they're having when they're actually experiencing a loss. You're going to hear me say that quite a bit, the importance of normalization. And then the last thing about this is that this particular one is less challenging than other types of grief. As we go through the rest of them, you'll definitely hear that it is a lot less challenging. So now we're going to take a little quiz just to kind of see how you guys do. So this is an interesting quiz I found. I came across on whatsyourgrief.com. At the end of the slides, you guys will see a resource page. And on that page, I do have whatsyourgrief.com. Again, it's a really great resource, not only for clinicians, but also for clients as well. And so this question came from that. And the question is, which of the following grief-related behaviors is considered abnormal? So letter A, a father who visits his son's grave every morning. Letter B, a woman who refuses to part with her deceased mother's belongings. Letter C, a woman who avoids the restaurant where she met her deceased husband. Letter D, a man who experiences intense emotional days 2 years after his daughter's death. Or letter E, none of the above. You have no idea what is normal for anyone else in the grave. So I see some of you guys in the chat are already putting down the answer. A lot of you guys are saying E. I'm seeing a lot of E's. And yes, you guys are correct. Letter E. So let's break each one of these down. So the first one, a father who visits his son's grave every morning. So I have several friends who identify themselves within the Buddhist community. And it's very common for individuals in the Buddhist community every morning to visit the gravesite of a loved one. Or sometimes they may have a special place in their home. And every day, every morning, they visit that special place in their home to give acknowledgement to those who's died. Letter B, a woman who refuses to part with her deceased mother's belongings. So think for a moment about an heirloom. Many families have heirlooms that they pass on from generation to generation. I know for myself, my grandma died. My maternal grandmother died. They allowed all of us nieces and nephews and grandchildren to go into the home and get whatever we wanted. And so she wore hats to church all the time. So I got a couple of her hats, and I still have them to this day. Letter C, a woman who avoids the restaurant where she met her deceased husband. So think back for a moment when we talked about acute grief, that early time period, as soon after the loss, where emotions are really intense. So let's say an individual, this particular woman, is going through her grieving process, and maybe it's soon after her husband died. And this particular restaurant is a trigger for her. Every time she goes by the restaurant, she drives by it, she walks by it, it's a trigger for her. So it can be helpful for her to avoid the restaurant until she processes and works through some of her grieving journey a little bit more before going by that restaurant again. And then letter D, a man who experiences intense emotional days 2 years after his daughter's death. So going back to what we talked about as far as integrated grief, that ultimate goal that we're trying to get to. So let's say he's able to function in his daily life, he's able to go to work, take care of his children, take care of whatever he needs to take care of. And then his daughter's birthday comes up. So a few days before his daughter's birthday, he might experience acute grief again, the intense emotions. Maybe the day of her birthday, he might cry a lot, might even call out of work. And maybe even a couple of days or a couple of weeks after his daughter's birthday. He might still experience that acute grief. And so all of these things are normal. You guys are absolutely right. So it's important that we keep in mind when we're working with our clients and some of these signs might pop up for them. It's about normalizing some of their experiences as well. And again, we're going to talk about other types of grief that are more challenging. And so I know complicated grief and prolonged grief, it's a term that's used interchangeably, but it's the same concept. And so basically what it is, it's when normal grief becomes severely long in duration. And it's usually when the grief is significantly impairs an individual's ability to engage in daily functioning. And so complicated grief is a term that was coined in the 1990s. And it's something that is still being researched to this day. And as we're going through the different types of grief, you'll hear that some types of grief has had a lot of research done and others not as much research, and we're still learning about it. And so the presentation for complicated grief are violent outbursts, radical lifestyle changes, low self-esteem, substance abuse begins or increases over time. There's a consistent feeling of guilt for some people. There's rumination about how the person died, or maybe where they were when they heard about the person died, or the person's death itself, or the loss of experience. Hallucinations of the deceased, yearning for the other person, and also suicidal thoughts. And so there's different factors that can cause people to experience complicated grief. The first one is the nature of the loss. I know someone earlier had talked about a natural disaster. Natural disaster can definitely be traumatic for some people. So the nature of the loss can cause people to get stuck in the grieving process. The relationship with the deceased as well. Life experiences, including trauma. So sometimes it could be abuse that's happened. An individual who's been bullied, an individual who has experienced maybe witnessing the death of a loved one. Those can definitely be signs of someone possibly experiencing traumatic or complicated grief at some point in their life, if they've had a history of traumatic experiences. And then attachment style is definitely another one. And social issues. Social issues can definitely play a role. And we're going to talk about disenfranchised grief with social issues to kind of get a better idea of how it can present itself in some of our clients. So this one we're talking about is PCBD. This is actually located in the DSM, persistent complex bereavement disorder. This is definitely under further study. And so the symptoms that we're about to list, they have to last at least 12 months after the death for adults and at least 9 months for children. And so they have to have at least one of the following symptoms. The first one is intense and persistent yearning for the deceased, a frequent preoccupation with the deceased, intense feelings of emptiness or loneliness, recurring thoughts that life is meaningless or unfair without the deceased, and a frequent urge to join the deceased in death. So again, these have to last at least 12 months after the loss for adults and at least 9 months after children. And then they have to have at least 2 of the following symptoms as well. So feeling shocked or stunned or numbed since a loved one's death, feelings of disbelief or inability to accept the loss, rumination about the circumstances or consequences of the death, anger or bitterness about the death. And later on, we're going to talk about guilt as well, how to help people who might be feeling guilty about a loss at the second half of today's training. The next thing is experiencing pain and the deceased suffering, or hearing or seeing the deceased, trouble trusting or caring about others, intense reactions to memories or reminders of the deceased, and avoidance of reminders of the deceased, or the opposite, seeking out reminders to feel close to the deceased. And so symptoms must cause substantial distress for the sufferer or impact significantly on areas of functioning and cannot be attributed to other causes. And so this is directly taken from the DSM. And so, and most recently, the PGD, this is the prolonged grief disorder. This is the within the ICD. This was has taken effect as of January of this year. So this is new. It is a part of the disorder specifically associated with stress. And so the essential features is a history of bereavement following the death of a partner, parent, child, or other persons close to the bereaved. A persistent and pervasive grief response characterized by longing for the deceased, kind of that acute grief that we talked about before, or persistent preoccupation with the deceased, accompanied by intense emotional pain. The pervasive grief response has persisted for an atypical long period of time following the loss. And so this part is very key to take note of. It says symptoms last most days at least 6 months after the death. So in the DSM, it said 12 months for adults. But this one here, it says 6 months after the loss. And the grief reactions that have persisted for longer periods that are within a normative period of grieving within the person's culture and religious context. So it does take into context the person's religious or cultural background as well. And if it's viewed as a normal time length within their culture, then they wouldn't be able to be diagnosed with PGD. And the last one is the disturbance results in significant impairment in personal, family, social, educational, occupational, or other important areas of functioning as well. And then these are some additional features as well. I won't read through all of these. Again, hopefully you guys all have the slides and you're able to take a look through these, but just kind of pull out one that I found very interesting was the second one, problems coping without the loved one, difficulties in recalling positive memories of the deceased, difficulty trusting others, social withdrawal, and the feeling that life is meaningless. And so as we're going through this, I just wanted you to think about your own clients and some of the things that they might be experiencing. And hopefully you're hearing some of the things that they might be experiencing, or maybe they aren't experiencing these at all. Maybe we'll talk some more about the other ones. You hear kind of some things that they're going through. But as we're going through these, again, try to keep in mind your clients. And later on, we're talking about different tools to help them through these grieving process as well. And these are related to children. And we're going to talk a little bit more children as well. But it does talk about the developmental aspects of grief. So the first one we're going to talk about is ambiguous grief. So ambiguous grief is a delay or a complication in the grief due to a lack of closure. And so when it comes to ambiguous grief, the person becomes very obsessed with finding the answer related to their loss. So for example, let's say an individual has been working at a company for 14 years and they are all of a sudden fired. And they aren't given much of a reason. They didn't have any past reprimands. There was really no reason at all. And so they get fired and they get stuck in trying to figure out why. Why did this happen to me? No one else got fired. And so they might ask a lot of questions. And maybe someone shares with them that, well, we decided to let you go because your position is no longer needed. We're kind of rearranging the company. And maybe that answer is not good enough for that person. And they still get stuck in no, there has to be another reason. And so sometimes they might get so stuck in the why that the rest of life begins to deteriorate. So going back to that example of the person who lost his job, he's stuck in the why. Why did this happen to me? I don't understand. And maybe it begins to question their abilities to work. Maybe they begin to question their professionalism. They begin to question their own self-esteem. And then they become depressed and they may not leave the home. They may not even try to apply for other jobs because they're so stuck on, I don't understand why this happened. And so it goes with the next one, struggling with accepting the reasons presented. And then the next one is paranoid, that there could be other possible answers. And so that kind of goes into the self-esteem. Maybe I'm not good enough. Maybe I didn't bring enough value to the organization. And then the next one is, it's important for us to meet our clients where they're at. It's important for us to not try to knock down the walls of, no, it has nothing to do with you. No, you're a great person. We're going to talk a little bit more about that here in a little bit, but it's more about meeting our client where they are. Help them to identify, well, what did you expect your life to look like? You thought you were going to be there for another 20 years. What's it like for you not to be there for another 20 years? Or would you like life to look like now that you're not there anymore? And again, we're going to talk more in detail about different techniques and strategies that we can do to help our clients move from this place of ambiguous grief to this place of acceptance, to the place of integrated grief that we talked about earlier. And again, it's about slowly chipping away at that paranoia. And the next one is traumatic grief, kind of what it sounds like, traumatic grief. And so the key here is the nature of the loss. And so it could be a sudden loss. It could be, someone had mentioned earlier, a natural disaster. It can be a death due to something violent, whether they witnessed the violent death or they heard about the violent death. Another one is experiencing multiple losses at a time. And then COVID-19 and the unknown. So way back in 2020, when COVID-19 first came to fruition, many times nobody knew what it looked like. We just knew something was happening and we had to stay indoors. And so for some people who ended up catching COVID-19, their loved ones drove them to the hospital, and they parked the car and thought they were going to go in the hospital, but a lot of people weren't allowed to go in the hospital at the time. So them dropping their loved one off at the door was literally the last time they saw their loved one. And they may have thought, well, I'll just come back in a few days and check on them. And they're still not able to get into the hospital. And so now, because it's this unknown event happening, they aren't able to talk to their loved one, they aren't able to see their loved one. Can you imagine what they experience? Just the idea of not knowing what's happening. Of course, if we as human beings don't know what's happening, many times our mind will go to the worst case scenario. And that's what will happen to a lot of people. Their mind went to the worst case scenario. And then they find out that the loved one died in the hospital. So they never got to say goodbye to the loved one. That could be very traumatic for a lot of people, and a lot of people are living with that traumatic experience of not even getting to say goodbye to the loved one. And it can be challenging working through that traumatic experience. So it's important for us as individuals who are giving support to remind ourselves, again, meeting our clients where they are. And then the next one is focusing on the trauma. It's crucial that we work through the trauma first before addressing the grief itself. So there's a study that was done in 2013 with Murphy and Johnson, and they looked at the bereavement of trajectory of 173 parents who lost their child. And so they lost their child due to an accident or a death of some sort, or suicide even. And so in this particular bereavement trajectory that they did, the study found that 5 years after the loved ones had died, 27% of the mothers and 12% of the fathers ended up being diagnosed with PTSD. So that goes to show how losing a loved one through something traumatic can even lead to some clients experiencing PTSD. So it's very important that we're aware of that, of how the person died and how it can lead to PTSD as well. So next what I want to talk about is anticipatory grief. And we're actually going to watch a video. This is a video by Dr. Nancy Fumer-Chiron, and she's a clinician director at the Children's Room. And so hopefully the video will work. I know it worked the other day. So let's see.
When you shared, Tiffani, did you share sound?
Yes, I did share sound.
Okay.
Yeah.
Typically, we talk about grief occurring after usually actually after a death, and sometimes after some kind of other significant loss. Here we're talking about the minute you have information that suggests, one, that there's going to be that loss, and that leading up to it, there are a whole host of other losses that occur that you can anticipate. You already know something's going to happen. And with that comes a lot of anticipatory, often anxiety, as well as grief. So we're not necessarily talking about the grief that occurs when the actual loss occurs, or particularly when the death occurs. We're talking about the losses along the way and the grief that goes with those in anticipation of what we know is to come. The kinds of things that won't happen, that I'm not going to see my child go to kindergarten, that I'm not going to see my child play on a sports team, that I'm not going to see my child go to college, that I'm not going to walk my child down the aisle, that we're only going to have 2 living children in our family instead of 3. Those are the kinds of things that people suddenly come to realize because whatever they had expected is now not going to happen. You know, that people are experiencing all these feelings, all the things they had hoped for, all the things they had thought were going to happen, that they now realize they've been given information that makes them know those things are not going to happen. And to be able to validate that sense of, I'm already feeling sadness about what isn't going to happen, even if the death itself hasn't occurred yet, is really important. That families need to know that those feelings are normal and that what they're experiencing long before the death of a child are important to validate.
Yeah. And so kind of reiterating what she shared, it's this in-between place. On one hand, their loved one is alive, and so they're trying to embrace every single moment that they can with that loved one. On the other hand, realizing that their loved one is going to die at some point. Their loved one's no longer going to be here. So also thinking about what's going to happen after the loved one's no longer here. So it's this in-between place that happens. And so it can be very isolating for a lot of people to experience this. It can be very a challenge because no one's acknowledging what they're going through. So just for a moment, think about the partner who may have heard that their loved one is going to die from cancer. And people visit them at the hospital. What's one of the first things they're asked? So how's your spouse doing? Or maybe they're making statements such as, it's great that you're gonna be able to spend the last few months together and you're gonna be able to say your goodbyes. And so it sounds encouraging, it sounds supportive, but in all actuality, it's not acknowledging the individual who's experiencing anticipatory grief. So just for a moment, I want you to think, what are some actual empathetic, truly empathetic statements that can be helpful for some of these partners to hear who's experiencing anticipatory grief? And so you could just share in the chat the type of healthy and helpful and empathetic statements that can be encouraging to someone experiencing anticipatory grief. What are some things that you guys can think of? So a few is, wow, I can't imagine what that's like to have to watch his spouse slowly die. How are you doing? So did you hear how it focuses on the person, the individual? Or maybe, wow, this whole situation is challenging. I'm sure it's hard to handle. What are some things you're doing to take care of yourself? Because many times when an individual is experiencing anticipatory grief, they forget to take care of themselves. They might forget to eat. They might forget to just embrace daily hygiene because they're so focused on, I have to rush, I have to get to the hospital, I have to take care of my child, I have to go here, I have to go there. They forget to take care of themselves. So sometimes simply acknowledging, how are you doing? What's going on with you? Can be truly empathetic as well. And so when it comes to anticipatory grief, there's an anticipatory grief scale that can be utilized. And there's been a lot of studies been done in this aspect of anticipatory grief. And there's a Swedish study that was done with widows whose relatives were dying of cancer. And the study used the anticipatory grief scale, and it's basically a self-assessment questionnaire based on what they are currently experiencing. So the questions range anywhere from, how are you doing with the diagnosis? Are there moments of daydreaming about the person? What are your feelings? What are the reactions? What are your future thoughts as far as once a loved one has died? And so this particular study revealed that 40% of the widows reported that the pre-loss period, so while their loved one was still alive, was more stressful than the post-loss. So they felt more stress during their loss while their loved one was still living versus after their loss. So just an example of just how strenuous it can be to be in anticipatory grief, this middle space as well. There's another study that explored relatives who reports missing their loved one and longing and difficulty accepting that there was this terminal aspect to the loved one as well. And there's this really huge preoccupation with what's going to happen in my future. And in children, it's quite often that happens in children, what's going to happen in the future for me. And so it can be very helpful for people who are experiencing anticipatory grief to, again, for them to be acknowledged during this experience as well. Somebody had mentioned, what can I do to help through this? Yeah, that's a great question because you're acknowledging the individual. It's a very empathetic question. Yeah. It's okay to have those feelings you're experiencing. Yeah. Thank you guys for sharing that. Yeah, definitely. And so this statement I thought was very helpful from Dr. Lynn Eldridge. It says, grief before death isn't a substitute for grief later on, and it won't necessarily shorten the grieving process after death occurs. And that's so true. Just because an individual has had the opportunity to grieve and to say their goodbyes, it does not mean they're not going to continue grieving afterwards as well. Next, what I want to talk about is distorted grief. And distorted grief, it's basically when an individual experiences the first two criteria and the third one of the first two and the third one. So the first criteria is extreme feelings of guilt or anger. The second one is hostility towards a particular person or group of people. And the third one is engaging in self-destructive behaviors. So unfortunately, in the past, maybe 20 to 30 years, there's been an increase in school shootings. And unfortunately, they've become more prevalent. And so when I first learned about distorted grief, that's where my mind first went to. I was in high school when Columbine happened, the Columbine shooting. And so I thought about an individual who may have said, Mom, Dad, I don't want to go to school today. Please let me go to school. And the parents like, nope, you have to go to school. You go to school every day. You have to go. And the child goes. And unfortunately, that day is the day that the school shooting happened. And the child dies in the school shooting. And the parent ends up feeling a lot of guilt. And so that would be the criteria one, extreme guilt, extreme anger. And they might engage in self-destructive behaviors. So it might be increased in substance use. And so in this case, they would be experiencing distorted grief. So that's an example of distorted grief. And so verywell.com, again, that's another resource on the resource page at the end of the slides that you guys have. They had a very great overview. And their overview was whether we express your grief with a safe person you trust, or you let it out in a complete private place. Expressing your feelings is the only true way to honor your grief and begin to work through it. And that is very helpful when it comes to distorted grief, because a lot of times it turns to self-destructive behaviors. So it's important for us to help our clients be able to let out their anger, express their guilt in a healthy way, in a way that is not self-destructive. And again, we're going to talk about different tools and techniques that we give to our clients that are healthy, that's not self-destructive as well. And so next we're going to talk about is delayed grief. So delayed grief is kind of what it sounds like. It's when someone experiences a grief, but it shows up later, or it resurfaces later on in time. And so keep in mind, when we're talking about delayed grief and when it arises, many times our clients are confused about what's going on. They may not understand why all of a sudden their grief is popping up. And so it can be very challenging for some. So this is where psychoeducation can be very helpful and beneficial to them, and explaining that it sounds like you're experiencing delayed grief. And there are several reasons why someone might experience delayed grief. So one of the reasons is because maybe they have to automatically take on new responsibility. Going back to what was mentioned earlier, as far as being the podcast, in my podcast of Managing My Grief, I also do support groups throughout the year. And I remember one of my support groups I was doing in Virginia, a woman had shared with me that she never mourned the death of her father. She never mourned the death of her father because as soon as he died, she automatically took care of her mom, who was still living. And she was considered the strong one, quote unquote, strong one in the family. So her siblings leaned on her for support. And because she had all these new additional responsibilities, she never got an opportunity to mourn and grieve her father's death. And so it wasn't until years later when her mother died. Again, she became the strong one in the family and her siblings leaned on her. And then a few more years, and she was able to grieve her mother's death as well. And then a few more years later, she was finally able to have the capacity and the space to grieve her mother's death and her father's death. And when it happened, she didn't understand what was going on. One day she was sitting at work and she just started crying and she didn't know what was happening. And then she began to call out of work more often. And she ended up going to seek support, a mental health therapist, and they began to realize that she never got the opportunity to mourn. And so maybe you have clients like that. Maybe they experience a loss and they immediately have more responsibilities. Just kind of providing the psychoeducation with them, letting them know, hey, at some point it's going to come out. So just be aware of that. Maybe not right now because you have 95,000 things on your plate, but at some point it's going to end up coming out. And it may come out in different forms. It may come out in the form of anger. may come out in the form of depression, may come out in the form of lack of motivation to doing things, or just feeling overwhelmed with a lot of things. Or in this case, with the individual that came to the workshop I was doing, simply crying a lot. So it can definitely come out in different forms. Another example of why somebody might experience delayed grief is because it's followed after their own health concerns. So maybe someone has experienced a loss and then they find out that they've been diagnosed with cancer, or they experience the loss of an ability within their limbs. And so because they have their own loss, personal losses they're experiencing, it's hard for them to grieve the loss of someone who's died. The next one is a reason why is because a major event may have happened. So maybe someone experienced a loss of a loved one, and then they all of a sudden go through a divorce. A divorce is definitely a huge loss for some people. Or maybe they lose their job. Or maybe there's another major loss that they go through. So they aren't able to have the mental capacity to focus on the death that's happened because of this other major loss that's happened as well. And then another one is maybe the individual has other responsibilities that might come up. So there's kind of this overlaying arch, I guess you could say. So someone experiences a loss and there's just other responsibilities that pop up. So they aren't able to have the capacity to express and to grieve the loss that they've had. So that's delayed grief. And then this was an interesting quote. I'm not sure who's shared this quote, but I thought it was very interesting. It says, sit with it, realize it, acknowledge it, experience it without judging it. Throw the timeline away and don't worry how many days, months, or years it has been. Don't let the calendar decide how you should be feeling. Grieve in the way that you weren't able to before. And I thought this was very helpful because many times whenever an individual experiences delayed grief, many times they think, that happened years ago. My loved one died years ago. It was months ago. I shouldn't be grieving now. I shouldn't be crying. I shouldn't be feeling sad anymore. And so letting them know that there's no timeline, there's no specific trajectory of this is how it's supposed to look and you have to do it within this time period. Letting them know that it's okay. It's whenever it happens. There really is no timeline on when grief should or should not pop back up. It's different for everybody. So next I want to talk about is mass grief. And so mass grief is under the umbrella of complicated grief. And so mass grief is when someone is unable to recognize that their physical symptoms or their maladaptive behaviors are related to their loss. And so I like how Grief Recovery Method shared it. And so Grief Recovery Method is another organization that's on the research or the resource page that's provided. And what they shared on Grief Recovery Method was a very interesting way of explaining mass grief. So they said the human body is designed to be a processing center. So we consume food and we process the food we eat. Then it creates energy, it creates fuel for our various organs. But if we consume more food than necessary, our body begins to store it as fat. Too much fat storage can become unhealthy and result in negative consequences for our overall health. So likewise, the body is designed to process our emotional experiences. If we suppress, store, and mask those emotions deep inside, this can result in negative consequences for our general health as well. And so I love giving these examples to my clients because it helps them to resonate. It makes sense to them when we're able to realize that when we store up our emotions, it builds and builds and builds, and at some point, it's going to come out in an unhealthy format. And in this particular way, it comes out in physical ailments. So I'm sure you can probably think of a client who continually stuffs down the emotional pain. And at some point, it ended up manifesting in a physical ailment, such as an ulcer or a headache, migraines, stomach aches, body aches as well. And thankfully, in recent years, there's been a collaboration between mental health therapists and the health field, the doctors and primary care physicians as well. And a lot of primary care physicians, they've done a lot of studies and a lot of tests, and they aren't able to figure out, why is my client having these physical ailments? Maybe it's something mental health related. And so we're getting a lot of referrals. I know I've gotten quite a few referrals from primary care doctors who's unable to figure out why their client is having these physical ailments. And so sometimes it's because our clients are stuffing down their emotions. And so an example of this could be a client comes in and says, you know what, I'm fine. I'm okay. I'm fine. But in reality, they're not okay. And when it comes to masked grief, it's about recognizing that masked grief, it hides those emotions. And so mindfulness is a very wonderful tool to help counteract that, because mindfulness, it reveals, it gives space to be able to acknowledge what's happening in the present moment, the here, the now. And we're going to talk about some mindfulness tools and techniques, the second half of the training today. But it is important for us to be aware of this, especially when we're working with our clients who's coming in with physical ailments. Asking them about past grief as well can be helpful. So next we're going to talk about is exaggerated grief. So exaggerated grief is when an individual is so overwhelmed by their loss that the grief intensifies and it even worsens over time. And many times they end up developing a psychiatric disorder. Sometimes suicidal thoughts might pop up for them. They might have an increase in nightmares as well. Sometimes there's a lot of destructive behaviors that might happen. And sometimes they might have a disabling helplessness that they experience. And so when I first learned about exaggerated grief, my mind first went to the movie Jaws. How many of you guys remember the movie Jaws? I'm probably showing my age right now. But Jaws is a movie that came out in the 70s by Steven Spielberg. They even tried to do some remakes. Wasn't as good as the first one. But basically, I won't tell the whole movie just because you haven't seen it. But basically, it's a shark terrorizes a beach. And the police chief wants to shut down the beach. The mayor wants to keep it open because of money and tourists. And so my mind first went to this movie because I thought about the individuals who were on the beach who witnessed the sharks killing the people. Not only was that traumatic to witness, but I'm sure that there were some phobias that were developed. For example, thalassophobia, which is the fear of large bodies of water, or salachophobia, which is the fear of sharks. And just thinking about that movie, it really hit home to me, understanding this. And so a couple of years ago, I have an associate whose husband, uncle, and cousin died in 3 separate car accidents. And she ended up having this fear of getting into cars, which is amaxophobia. And she ended up going to therapy for it. And thankfully, she was slowly able to ride into a vehicle. She has to consistently be on her phone, so she's not focused on what's happening around her. But it took her a couple of years to be able just to simply ride inside of a car because of those deaths and how traumatic it was for her. Thinking back to early 2020 with COVID-19 happening, and a lot of people, again, going back to what I had shared earlier about dropping their loved ones off at the hospital and then never seeing their loved ones again. Some people, they could have developed nosocomophobia, which is the fear of going to hospitals. And again, it's important for us to be mindful of how phobias can be developed after a loss. And so the phobia can be developed related to what the person was doing when they heard about the death, or it could be related to how the person actually died. So for example, the associate that I had whose loved ones died in car accidents. She wasn't in the car when they died, but she heard about the car accidents. And so that's what caused her to experience that. Also kind of thinking along the lines of psychiatric disorders and COVID-19, there's an Asian Journal of Psychiatry recently published an article regarding chronophobia. And so chronophobia is the excessive fear of catching COVID-19. And the individual becomes very engrossed in and even stressed about what they're doing to help avoid catching COVID-19. So there's this really huge preoccupation with it. So sometimes they may even not leave their house which can cause them to develop agoraphobia, the fear of leaving their home. And so again, it's very important for us as clinicians and those who are supporting people who are grieving to just kind of keep an eye out for some phobias that might pop up. And that will help us to realize, oh, they might be experiencing exaggerated grief right now. And so when it comes to exaggerated grief, it's more about helping them to work through the phobia, whatever it might be. And once they get the phobia into a healthy place, then focusing on the actual loss that they've experienced. And so again, we're going to talk about different theoretical orientations and different grief models that we can utilize to help our clients move to this place of working through their grief after experiencing exaggerated grief as well. So the next one we're talking about is absent grief. And so we're going to have a Q&A here in just a minute. So if you guys do have any questions, please go ahead and put them in the chat, and I'll go through them here in just a moment. But we're going to talk about absent grief. And so absent grief, it refers to a prolonged state of denial when a person cannot even acknowledge a loss. It can also be described as an unusual long period in which a person reacts as if nothing has changed, even if they can acknowledge a loss intellectually. And so Grief Recovery Village is another excellent resource that I encourage to provide to your clients. Its focus is quite a bit on co-occurring disorders as well, Recovery Village. But they provide a very interesting article by Jennifer Kolff. And she says absent grief, this is where this actually comes from, the statement of absent grief. And so when she talks about this, it reminds me of my own personal experience. So I grew up in a military family, so I'm a military brat, and I spent most of my childhood overseas in Europe. And every summer we would come back to the US and visit my grandparents. And it was an amazing time. My parents are high school sweethearts, so they both grew up in the same town. So our grandparents were within 10-minute driving distance. So I got to see both sides of the family. And it was just an awesome time to be there in the summer. And then we'd go back to the UK and just kind of back and forth during the summertime. And so I had this concept that my grandparents existed, but they may not be people that I can see readily, but I know they exist. And so fast forward to a few years, in middle school, we ended up coming back to the US, and I got to hang out with my grandparents even more. And then college came, and unfortunately, my paternal grandfather died. And I ended up spending a lot more time with my maternal grandmother. We took road trips. We are really big Western fans. We love Western movies. And so we even took a road trip to Dodge City, Kansas, which was a lot of fun. We took a road trip from Georgia all the way up to Michigan, and we just had a wonderful time together exploring the country. And I remember kind of missing her sometimes, but knowing I could always call her, knowing I could always see her. And at the time, she was living in Georgia. And so she ended up moving back to Arkansas, her hometown. And I was at the time in DC. And I get a phone call one day from my dad. And he shares with me that my grandmother had died. And I heard the words, but it didn't fully resonate. I said, oh, okay. And we got off the phone, and I went about life. I went to work. I went about life as if nothing ever happened, as if I didn't even hear the words. And so my dad was talking about the funeral and everything. And I said, yeah, I'm not going to go to the funeral. I don't see a point in it. I'm not going. And the matriarch of the family, she ends up calling me, and she says, Tiffani, you need to go to the funeral. Because she knew how close me and my grandma were. And so I said, okay, fine, I'll go to the funeral. So I go to the funeral, and it still didn't register with me that she was dead. And so I walked around, gave everybody hugs. It was, I just saw it as just a time to see family. So I gave everyone hugs, and the ceremony happens. And one of my cousins goes up to the front, and we're saying our goodbyes, and he goes up to the front to the casket, and he begins to cry. And that was the first time I actually cried. But I wasn't crying because she was dead. I was crying because I saw my cousin hurting, and seeing him hurt made me hurt. And so I ended up walking out with him. And so within the Afro-American community, we have a thing called a homegoing. So we have the ceremony, and then we have the burial, and we also have a third location that we go to where we usually fellowship, where we eat and just kind of hang out with each other. And so we went to the burial. Again, it hadn't registered with me. I didn't cry. I was mainly there comforting other people because I saw them hurting. And then even at the fellowship afterwards, it still didn't register with me. And so I ended up flying back to DC, and I go about life as if nothing happened. And then there were some moments where I thought about my grandma, and I said, I haven't talked to her. I haven't heard her voice in a while. I should call her. And then I think, she's probably busy hanging out with one of her friends there in Arkansas. And so I would always have a reason not to call her. And it was always, she's probably busy, or I'll call her later. And then about a year and a half, almost 2 years after her death, I was driving down the road one day, and it just hit me. She's not here. And I remember crying and unable to control my tears. And so I pulled the car over and I called my dad. And the first thing I said was, she's really not here. And he knew exactly what I was talking about, because he knew I hadn't cried, I hadn't grieved, I hadn't mourned, I hadn't done anything. So he knew exactly who I was talking about. And he said, yeah, she's really not here. And so from that day forward is when my grieving process truly began. And so I was able to finally acknowledge that she wasn't here. So that's an example of absent grief. And so in 2014, there was a case study that was done as well related to absent grief. There was an individual. She was an 80-year-old woman. She had 3 children, 2 sons and a daughter. And she had raised them. And unfortunately, her 20-year-old committed suicide. And the mom was informed. She went to the funeral. But her children reported that she never cried. She acted like nothing ever happened. Whenever her son was brought up, she would always refer to the future. Oh, he should be here in a little bit, or he should be visiting me soon. He should be coming home soon. His bedroom was still the same as it was when he was 20 years old. And so this had gone on for 35 years. She had always thought her son was still alive. And so in her 80s is when her children had said, I think we really need to get help from mom. And so mom finally agreed, and she said, okay, fine, I'll go in to get some support. And so even the clinicians who were doing the evaluation on her, when she came in and the whole family was there, even in that moment, she was looking around for her son who had died 35 years ago, who committed suicide. She was even looking around for him, thinking, oh, the rest of the family's here. He should be here soon as well. And so, unfortunately, she ended up dying with absent grief. And so kind of thinking about the diagnosis, they ended up diagnosing her with an aggrievement disorder and also a delusional disorder as well. And so that's just a couple of examples of absent grief, how sometimes our clients can experience a loss, but they go about as if nothing ever happened. And that's their reality. Nothing's actually happened. So we're gonna do this last one, and then we're gonna go ahead and take a break, do a Q&A, and then take a brief break. So inhibited grief is the next one to talk about. So inhibited grief is whenever whenever an individual makes a conscious effort to not experience their grief. And so as we're going through this, it sounds very similar to mass grief and absent grief. But the major difference is with mass grief, it's something that's done subconsciously. So the person has no idea that they're pushing down their emotions, resulting in them having physical ailments. And then absent grief is the person simply doesn't have capacity to acknowledge the loss. So where inhibited grief, the person is able to acknowledge the loss, but they're making intentional decisions to not grieve. And so some statements they might say is, yeah, I'm okay, or no, it's not impacting me at all. The example that I first readily think of is an associate of mine that I met in college. So at the time, I was working at a youth shelter, and a woman had come and started working with us, and come to find out, her mom had died just a few weeks before she came working at the shelter. And she's a nurse. She was a nurse. And nurses, they work 12-hour shifts, 14-hour shifts. And so not only was she a full-time nurse, now she even took on this other position as someone who gives support to children who are coming into our shelter. And so one day I was talking with her about, wow, your life is really busy, going from back to back and having 30 minutes or maybe an hour of sleep and then coming straight to work. And she said, yeah, I did that because every time I have a moment of silence or a moment when I'm not doing anything, I think about my mom, and I don't want to do that because her mom was her best friend. She talked to her mom every day throughout the day. And so she intentionally kept herself busy, really dove into work, so she didn't have an opportunity to think about her mom because it was just too painful for her to experience. So this is an example of inhibited grief, someone doing something intentional to not experience their loss, not experience the sadness and the grief that comes along with experiencing a loss. And when it comes to giving this individual support, it can be challenging. It can be very challenging because, again, they don't want to experience their loss. So sometimes it's about asking questions about, well, what would it be like if you were to experience this grief? What is your biggest fear in acknowledging this loss? And helping our clients to identify what are those fears that they're having. And again, we're going to talk more about different language that we can utilize to help them get to this place of acknowledging and accepting this loss so they can start working through their grief as well. And again, it's about normalizing this experience. A lot of people go through this. You might even think about some people that you work with right now who might be experiencing something similar to this. It's about normalizing this experience for them. And so at this time, we're going to go ahead and do a Q&A and then take a brief break. So I'm going to try to pull up. And so for Q&A, I do want to check in. Am I going to get an email for Q&A, or am I just going to look through the chat? What works best for Q&A?
I just pulled out one question, so I'm going to just put it back in the chat so you can see it.
Okay, great.
There has been a couple questions about sending out the PowerPoint, and so at the end, I'll get back with you so I can get a copy that can go out to the participants. Or I can use the one that you sent before for the
the one that I sent
CDs.
before.
Okay.
Yeah, that's exactly, the same one. Yeah.
And then I just added a question for you that somebody asked earlier. Yeah.
Thank you so much. Thank you. Could delayed grief be present in parentified children? For example, loss of childhood. Yes, definitely. Yes. A child, many times children are the parents in some situations. And so they become an adult and they realize, wow, I didn't really have a childhood. And that can cause grief, definitely can cause grief. And we are going to talk a little bit about some techniques and different tools that we can use. Actually, a really good intervention that can help when a child is parentified and they are as the parent. And how do we help them grieve? And we'll also talk about children who may grow up in homes where they are abused. They experience physical abuse, mental, emotional abuse from their parents, and then their parent dies. How do we help them through that loss? And so there are a couple of interventions that we're definitely going to be talking about as well. Great. Another question, a certain type of grief more prevalent in certain cultures? Actually, disenfranchised grief. I'm glad that you asked that question. We're going to talk about how culture can impact our grieving process for many of our clients, but disenfranchised grief is a common one for cultures whose way of mourning may not be readily accepted in mainstream society. So disenfranchised grief, we haven't talked about that yet. We're going to talk about that here in a minute, but disenfranchised grief is basically when an individual is grieving or mourning, but their loss is not acknowledged, or how they're mourning is not acknowledged. And again, we're going to talk more in detail about that, but great question about culture. And so at this time, we're going to take a 5-minute break. And so I will see you guys in 5 minutes. There you go. All right. And so we're gonna go ahead and get back started. And this here, and this one we're talking about is abbreviated grief. And so this here is Apollo. I got this one from one of my friends from high school. This is her little one, her fur baby. And yeah, so when it comes to abbreviated, so I asked her for this picture to help kind of understand the story a little bit more, understand abbreviated grief. And so abbreviated grief is basically kind of what it sounds like. It's when someone experiences normal grief, but it's short-lived in the loss. And so a couple of reasons why someone might experience abbreviated grief is because maybe the connection they had with a person who's died wasn't as strong, or maybe there's some space that was quickly filled after the loss. Or sometimes anticipatory grief may have happened. So that's why abbreviated grief might happen as well. So the example that I like to give for this particular one is a story that I had the opportunity to interact with for a little bit. But there is a couple. They had two little girls, a 6-year-old and an 8-year-old, and they had bought a dog for the children, and the name of the dog was Lucy. And Lucy was just a fun-loving dog, and the girls loved him. They bought toys for Lucy. They just embraced Lucy a lot. And then what ended up happening was one night with the oldest girl, the 8-year-old, she ended up unfortunately leaving the back gate open. And the dog ran out and ended up getting killed. And the girls were devastated when they found out. They would draw pictures of Lucy. They would, when they get back from school, they would look for Lucy and ask mom and dad, hey, where's Lucy? And the parents had to remind them Lucy's no longer here. And so a couple of weeks later, they end up getting another dog. This dog's name was Milo. And they bought Milo all new things, all new toys and clothes and products. And the girls soon began to stop asking about Lucy. They stopped drawing pictures of Lucy, and now their pictures were filled with Milo and the family. And so that's just an example of abbreviated grief. There wasn't a strong connection between the girls and Lucy because they only had Lucy for a few weeks. And then that void that was there, it was quickly filled by Milo. So again, that's just an example. And so sometimes families and peers, they may disapprove of abbreviated grief, kind of thinking about individuals who lose their spouse and then a few months later they remarry. Sometimes their children or siblings aren't happy about that remarriage. So that's just an example of abbreviated grief. And again, as we're going through these different types of grief, it's about normalizing this experience for our clients. So this we'll talk about is disenfranchised grief. I talked about this just briefly earlier, but disenfranchised grief is by Dr. Kenneth Doka. And so Dr. Kenneth Doka was a professor. In one of his classes, they were talking about grief. And a young lady in the class had shared that she had been married for several years. She had children with her husband, and unfortunately her husband ended up cheating on her with the neighbor. And they ended up going their separate ways, and he ended up moving in just next door with the neighbor, and she stayed there in the home with the children. And a few years later, actually just a few months later, he ended up getting really sick and unfortunately ended up dying. And so the student in his class was talking about how some of her friends and families were making comments to her about, yeah, well, he got what he deserved, or I'm sure, that's relief off of your shoulders. I'm sure you're happy about that. Or, comments along those lines. And while there was a little bit of truth to some of the things, she said that, she actually felt really sad that he was gone. And none of her friends were able to acknowledge that sadness that she was experiencing. She felt sad because her children no longer had a father. And so that's when Dr. Kenneth Doka became interested in this concept of somebody grieving, somebody experiencing a loss, but that sadness, that grief that they're having, not being acknowledged. And so he did quite a bit of research, quite a bit of studies regarding this concept, and he actually coined the phrase disenfranchised grief. And so there's, so basically it's when others minimize or they don't acknowledge the impact of the loss, and someone experiences a decline in health and others don't acknowledge or understand that loss. So those are the two categories. And as he did his research and studies, he began to notice a lot of people kept saying the same things. No one understands why I should be grieving. Nobody understands. And so he actually breaks it down into different categories, and there's no particular order in the category that we're going in the order that we're going in. But the first one he talks about is loss that is not acknowledged. We talked about that just a moment ago. The young lady whose ex-husband has died, and her loss wasn't acknowledged by her friends. And sometimes it could be other things related to maybe the death of a pet, and it's not being acknowledged. Sometimes when there's a loss of a job, sometimes that's not acknowledged as well. And then the next one is relationship that isn't acknowledged. And so this often occurs. Oh, can you hear me okay? Oh, there's some background noise. This often occurs whenever individuals see that the relationship is not important. So for example, let's say someone loses a coworker, and maybe the family doesn't realize why the person's mourning so much because their co-worker has died. Someone had mentioned foster care earlier. Maybe a foster parent has their child ends up going back to their home, and the foster parent is grieving and mourning, and maybe the family and friends don't understand why they're grieving or mourning. Sometimes there are losses where people aren't blood related and people don't understand why someone's grieving. In recent years, cyber loss has definitely become more discussed. So cyber loss is basically whenever an individual connects with somebody virtually, online, whether it's through diverse platforms or diverse spaces, and they build a connection and a relationship with that person. They get accustomed to seeing that person, interacting with that person, or simply watching that person. And then that person dies and that connection is broken. And so sometimes people don't understand how you could even be sad that someone's dead when you've never even met them. You never talked to them in person. You never talked to them on the phone, but yet you're sad. So when that's not acknowledged, they're experiencing disenfranchised grief. Another one is when the griever is not acknowledged. And so this particular one is more about how the person grieves. So there's different ways people grieve. Some people grieve internally. And so when they grieve internally, they aren't showing their sadness. They aren't showing the grief that they're having inside. And so some people may think that they're okay and may not even think about asking how they're doing after the loss. And then some people, they may express their grief all the time. And it might become overwhelming for some people. So some people might intentionally avoid that individual because it's just too overwhelming to sit with them and to be with them when they're expressing those really intense emotions after the loss. And so that person's avoided, and resulting in them experiencing disenfranchised grief. And then another one is the way the death occurs. It's not openly acknowledged. So an example of this is because there's some type of stigmatization related to their death. So it could be a suicide. It could be an abortion. I work with quite a few moms who's had miscarriages and quite a few moms who also have had abortions as well. And many times when an individual has an abortion, that loss is not acknowledged by family members or by friends even. And also maybe death related to AIDS. That's sometimes not acknowledged. So usually it's because the way the person died is kind of brushed under the rug and something that we kind of just don't talk about in some families. And so when that happens, the person is not able to openly grieve and openly mourn their loss, resulting in them experiencing disenfranchised grief. And then the last one that he shares is the way the person grieves, which we talked about just a moment ago, the different types, ways people can grieve by it being internally, it's not acknowledged, or they're expressing a lot and it's overwhelming for some people as well. Going back to the griever isn't acknowledged, another example of that would be an individual who might have a mental disability. of some sort. So the individual, so some people might think because they have a mental disability, they aren't able to comprehend a loss, or maybe it could be a child. They're too young to understand that the person's dead. They're too young to miss the person, or even older in age. Sometimes people forget that even in older age, people can experience loss, and they may forget to acknowledge that older person as well. Right, so the next one to talk about is cumulative grief. And so cumulative grief is when there's multiple losses within a short period of time. And so due to COVID-19, there has been a lot of cumulative grief happening with a lot of people. And so thankfully they're now doing more studies on cumulative grief because of COVID-19. And so the current studies that they're exploring right now are related to burnouts within the healthcare system. So they're mainly going into hospitals and talking to doctors and nurses, and they're doing a lot of studies on how is cumulative grief impacting them. And so that'd be interesting to take a look at maybe a few years down the road to see the results of the research that they're doing now on this. But basically, when it comes to cumulative grief, another term is grief overload. And so basically, when it comes to cumulative grief or grief overload, it can be very overwhelming for the person. There's an analogy that I like to use with quite a few of my clients. I got it from Grief Recovery Method. And so basically, they talk about how most of us in our house, we have a junk drawer or a junk closet or even a junk room for some people. But usually there's just some space where we have different knickknacks, different things that we might need to use one day, but there's not really a specific place for it in our home. So you just kind of throw it in this one space. And so when we go into this space, whether it's a junk drawer or a closet or a cabinet, or even a room for some people, and when we go into this space, sometimes it can be challenging and overwhelming to try to find what we're looking for. And especially if we're in a rush, it can be a challenge and a bit overwhelming. And so it's kind of the same thing when it comes to cumulative grief. There's this storage of memories that we have, of losses that we have, and it can be overwhelming to think about even looking into the storage of memories and unhappy moments and sad moments and trying to pull one thing out. That can be very, very overwhelming. And so many times when I'm working with clients who are experiencing cumulative grief, I like to use analogies and metaphors. Metaphors and analogies can go a long way when it comes to working with our clients. And so when a client comes in and I know they experience cumulative grief and they share with me, you know what, Tiffani, I'm on the verge of having a nervous breakdown. I feel like I'm going out of my mind. I don't even know where to begin. I don't even know where to start. Maybe you've had clients that's walked in saying the same thing. I don't even know where to begin. It's just so much happening right now. And so what I do is I share with them this idea of us going into a pool. So we have a pool in front of us. On one end, it's about 3 feet. And on the other end, it's 12 foot. Well, we aren't going to dive into the 12-foot end of the pool. We're going to start with a 3-foot end of the pool. And we're going to first sit at the edge of the pool and just kind of dip our toes in, just to feel the temperature of the water. And once we get comfortable, we might walk a little bit into the pool. And as we get more comfortable, we might walk a little bit farther into the pool. And at some time, we might start doing different swim, right? Doing some underwater swimming, or might even doing a backstroke at some point. And usually when I say backstroke or floating, they kind of laugh for a second. And I do want to let you guys know it's okay to have humor in therapy. And the clients that you're working with who are grieving, it's okay to have humor from time to time. Humor can go a long way in the healing process. And so I talk with them about, we're going to do some backstrokes sometimes, and sometimes we're going to get over to that deep end of the pool. And if you feel overwhelmed that week, if you feel that there's just so much happening that week, and you come in and say, you know what, I feel like I'm drowning, then it's okay. We will probably do mainly coping skills the rest of the session. We'll do some meditation the rest of the session. We won't do any deep work. And it's interesting, whenever I give this scenario to my clients, when they come in, they're able to let me know, I'm on the deep end this week, Tiffani. I feel like I'm drowning. And I immediately know, okay, they're feeling overwhelmed. A lot of the stuff that's happening in their life is overwhelming them right now. So we're going to take a different direction in therapy and just focus purely on coping skills and managing our emotions at this present moment. So I definitely encourage you guys to embrace analogies and metaphors when it comes to working with different types of grief, especially cumulative grief. It can be very, very helpful and therapeutic. The next one I'll talk about is collective grief. So collective grief is basically when a loss happens and it impacts a community. So it can be a community, it can be worldwide, nationwide. This particular picture down here at the bottom to the left is Hurricane Katrina that happened in 2005. It devastated a lot of people. It was a Category 5 hurricane where almost 2,000 lives were taken that time. And then in the middle picture, that is from 2018, the shooting at Parkland, Florida, where 17 individuals were killed that day. And students, they all came together at that time and they did a march for our lives in DC. And I just remember here in DC, just the community coming together and marching there to solidify their stance when it came to gun laws. And then this last one is 9/11. And I'm sure all of us can probably remember, those of us who are of age, we can probably remember when 9/11 happened, exactly where we were, what we were doing, what space we were in when we heard about 9/11 happening. And just thinking back to that time, how it impacted our entire nation. At that time, we saw an increase in people joining different government organizations, wanting to do something to help, wanting to do something to help figure out what was going on. And also, whenever it comes to these events that impact the community, it's important to keep in mind that it can bring a lot of validation to a lot of people. Because many times when someone experiences a loss, it's a very individual experience and they feel that they're alone. But when it's entire community, entire nation in these cases that's impacted, it can bring validation. It can help people to realize, wow, I'm not alone in this experience. And sometimes that can bring comfort to people in itself. And so also, when it comes to collective grief, there are different ways people might mourn. So in this particular way, in the picture in the middle, they did a march. In 9/11, a lot of people enlisted in government organizations. And many times when a famous person dies, there's a vigil of some sort. I know here in DC, whenever there's a tragedy that happens, all the flags fly at half-mast. Not only in DC, but on any government property, the flags fly at half-mast. So that's an example of showing a way of mourning. And it can, again, bring a lot of validation for a lot of people. But also kind of keeping in mind, just because a community grieves together, it doesn't necessarily mean that everyone agrees on how to show the grief that they're experiencing, on how to mourn. And so the first example that I think of was, I had talked about it just a moment ago, Columbine in Colorado, the shooting that happened in 1999. There was some disagreement on how to show mourning in this particular situation. So basically, two shooters went into the school, the Columbine High School, and unfortunately ended up killing 13 people, 12 students and a teacher, and many other people were harmed that day as well. And the two shooters ended up dying that day as well. So it was a total of 15 people. And there's an individual who heard about it, and so he wanted to show support to the community. So he created crosses for every person that died. So he made 15 crosses, white crosses. And so he traveled across states, because he didn't live in the state of Colorado. He traveled across some states, and he put up the crosses to show the lives, to represent the lives that were lost that day. And people in the community, some people thought it was a great gesture and they loved it. Then other people in the community thought it was disrespectful because he also included the two shooters as well that got killed. And so some people came and destroyed those crosses and tore them down. And the gentleman, he heard about it, so he made 15 more crosses, and he traveled across state lines and he put it back up again. And people in the community got upset again, and they tore down those crosses again. And so just this back and forth. And so finally, the community stepped in and said, you know what, we're going to create a memorial for the individuals who's died, and we're going to fence it off so it cannot be destroyed. And so that's just an example of, even though a community can experience a loss, it doesn't necessarily mean everyone's going to agree on how to mourn or how to show respect to those who have lost, who have experienced a loss. And so for those of you who work within the community, you might have opportunities to talk with people who, within organizations, to talk with people or schools who have experienced a loss. I know when I first started out in the mental health field, the organization I was a part of, we had a crisis team. And so part of the role, one of the roles in our crisis team was whenever there was maybe a death in a school or a suicide in a school, we would then go out to the school and talk to the assembly. So talk to the teachers, and then we would talk to the students in groups about how they're doing it. So you might have opportunities like that. And so later on today, we're going to talk about different techniques and interventions we can utilize in those situations. But it is important that we are aware of collective grief and how it can impact everyone. And again, how it can be validating for some, and other times it can actually cause more challenging moments after the loss as well. The next thing we're talking about is COVID-19 and grief. And so we already talked quite a bit about this already, but just that initial experience in early 2020, when we had no idea what it looked like. We had no idea if our person was suffering, if they caught it. We didn't know if they died calmly and peacefully in their sleep. So again, we as human beings, many times our mind goes to the worst case scenario when we're unsure about some things. So for a lot of people, that was very challenging for them to not know what was going on with the loved one, and they couldn't go into the hospital as well. And the social distancing definitely impacted the grieving process, because think about our clients. A lot of times where our clients are grieving or going through challenging moments, what's the first thing they do? They go hang out with their friends, or they might go to the movies. They might go bowling or go skating, or they do something. They might go out to dinner. A lot of people are foodies, so they enjoy going to dinner. But when COVID-19 happened, a lot of places were shut down across the nation. And so they didn't have that outlet anymore. And so it was very challenging for them to grieve. A lot of people went stir crazy at the time as well. Another thing is triggering previous losses. That happened quite a bit during COVID-19. Maybe they were cleaning out their closet because they had nothing else to do. They couldn't go anywhere. So they were cleaning out their space, cleaning out their closet, and they saw pictures of someone who's died, or maybe they saw a jacket or a hat of someone who's died, and it triggered them to think about their losses. And that could be challenging for some people to relive those losses that they've had. Another one is individuals not bereaved by COVID-19. This, unfortunately, there's a lot of stories, a lot of clients who I know experience this. But what happens for some is that they had a loved one who died, but it wasn't related to COVID-19. And so one of the first things people ask was, oh my goodness, was it COVID-19? Is that why your loved one died? And the person shares, no, it wasn't COVID-19. And usually the response that they got was, oh, well, that's good, it wasn't COVID-19. And so the person misses the point that the loved one is dead, the loved one is gone. And so quite a few of my clients experienced that during COVID-19. Maybe you've experienced that with some of your clients as well. Their loved one's death was minimized because it wasn't COVID-19. And then also just thinking about the support as well. When someone had died from COVID-19 at the time, and still some places, it was a limited amount of people who could attend the funeral or the homegoing. And so, as I mentioned earlier, within the African community, for a lot of people who do homegoings, it's the time of fellowship. So there's a lot of us that come together. And so for it to only be 10 people is the max number. A lot of people didn't get that support and encouragement that they would typically receive if everyone was able to come. And another example of this that a lot of my clients that I have seen through COVID-19 is that a lot of their parents didn't want to go to the hospital. So they're sick and they need to go to the hospital, but they didn't go to the hospital because they had this fear of catching COVID-19. Again, we didn't really know what COVID-19 looked like, but we just knew that it's something that we didn't want. And so a lot of people didn't go to the doctor. A lot of specialists they close their office and said only if it is an emergency can you come in. So a lot of people weren't able to see their specialist as well. And so unfortunately, a lot of people, they ended up dying because they never went to the hospital to get the support that they needed. They didn't go to the specialist to get the support that they needed because they had this fear of catching COVID-19. So it's important that we're mindful of our clients who are experiencing that as well. And then chronophobia, we talked a little bit about that as well, the fear of catching COVID-19. All right, and so this one here isn't necessarily a type of grief, but it is still important for us to be mindful of primary loss and secondary loss. And so primary loss is that initial loss. So that initial break in a relationship, that initial experience that they've had. And then secondary losses are those hidden losses, those voids that are left due to that initial loss. And so what I'm going to do for a moment, I want to give a couple examples, and I'm actually going to pull up the chat. Hopefully it works well. Great, it didn't block anything. So I'm going to give a couple of scenarios and see if you guys are able to identify some secondary losses that the person might have. So let's say, for example, the primary loss is an individual, a teenager loses their mom. They lose their mom. What are some secondary losses or some hidden losses or some voids that you think that that teenager might experience? And so someone says loss of dreams that their mom will witness major milestones. Yes. Graduating from high school, their mom's not gonna be able to witness that. Yeah, definitely avoid. Loss of cooking. All right. So yes, his mom was the main cook in the family, definitely. Loss of emotional support. Yes. Maybe mom was the one giving the little one support. Yeah. Friends may have to move away. Yes. Actually, that happened with one of my clients. I was a teenage client I was working with. I won't talk about her here again in a little bit. But her mother died, and she ended up moving with her sister. And her sister lived in a different state, so she had to move states. So she's in high school, and so she had to say goodbye to all her friends, the space, the world that she knew there in Baltimore, and she moved to a different state. So definitely a lot of losses in that, definitely. Loss of bedtime togetherness. Yes, many times families have routines, bedtime routines, morning routines. And so now that mom's no longer there, the teenager doesn't experience that same routine that they once had. Definitely. Good job. Thank you guys for sharing that. So the next example is, let's say someone loses their job due to COVID-19. Someone loses their job. So the primary loss is loss of a job. What is the secondary loss? What are some other losses that they may experience later down the road? So those hidden losses. Sense of self. Yes, I'm glad you said that. A lot of people, and we ourselves might do this as well, but a lot of people, they identify themselves based on what they do. Their identify is deeply interwoven with their job, their occupation. And so if they lose their job, they might lose a sense of their identity as well. And so again, later on, we're going to talk about some interventions that we can do to help our clients who might be experiencing a loss of identity. Yeah. Loss of coworkers and friendships. That is so true. A lot of us don't realize, but we spend a lot of hours at work. Some people spend most of their time at work. We work 5 days a week, 8 to 5, sometimes people 8 to 6, 8 to 7. And most of the time we're around our coworkers. Some people spend more time with the coworkers than they do with their own family. And so to lose their job, they're basically losing a second family that they have as well. Loss of daily routine, that can definitely impact in a lot of different ways. Not getting up at the same time every morning, not having the ritual of driving to and from work and doing those different things as well. Yeah. Paycheck, yes. Loss of income, definitely a secondary loss, definitely. Yeah, good job, you guys. And so the next thing we're going to talk about is the experiences of grief. And so many of you guys, I'm sure at some point, have heard of the 5 stages of grief, or some people might say 7 stages or 8 stages. And so it derives from Dr. Elizabeth Kubler-Ross. She was a Swiss-American psychiatrist. If you guys ever get an opportunity to hear her speak on just through some of the recordings, I definitely encourage you. She's a very, very interesting woman. Very interesting woman, very direct woman. But she wrote a book on death and dying. We're actually going to read a few excerpts from her book on death and dying. I encourage, if any of you guys have not read the book, to definitely read it. But basically, this is where the 5 stages of grief come from. And in her book, she talks about interviewing 200 people who were terminally ill. And she talks about their experience. And she was able to categorize their experience into these 5 stages. And there's a lot of controversy. We're going to talk about the controversy about the book here in a little bit. But one of the first things that she talked about in the first chapter was this idea of death and how death was to look, how people expected death to look. And so in the first chapter, she gives a comparison of an individual who she knew who died in their home. It was a very small town, and the individual was able to die in their home, and they were able to have the people that they wanted, their loved ones, come and say goodbyes. And she talks about how it was just a very peaceful moment, how it was all in the control of the person who was dying. And it was their decision on who was there in their space and how things were going to look. And then she gives a comparison of what happens when people die in a hospital, how sometimes decisions are made for them, or how sometimes they are talked about while they're in the hospital, but the doctor's talking to family members about the person. And how sometimes it's very impersonal, and how sometimes it's not a homely or peaceful feeling because it's simply just white walls they're surrounded in. And so she gives that comparison, and then she dives into the actual stages of grief. And so while we're going through this, you will hear some language geared towards doctors and nurses, because that's initially what this book was designed for, was to help doctors and nurses be able to relate better to their clients and to treat their patients more like people, like human beings. And so while we're going through this, there's 2 folds that I want us to keep in mind. So on one fold, yes, she is talking to doctors and nurses and clergymen as well about interacting with people who are dying. But also, since the book has been written, people have applied it to those who are living, people who have experienced a loss and now they're grieving. So it's 2 folds to this. So kind of keep that in mind while we're going through this, okay? So the first one she talks about is denial, this concept of denial. And so what she says is denial, at least partial denial, is used by almost all patients, not only during the first stages of illness or following confrontation, but also later on from time to time. Who was it who said, "We cannot look at the sun all the time. We cannot face death all the time"? These patients can consider the possibility of their own death for a while, but then have to put this consideration away in order to pursue life. And so for those of you who might be working with individuals who are terminally ill, keeping that in mind, this concept of denial, that there is a benefit to it. It helps them to be able to function, to go about their daily life. It helps them to be able to interact with people. At the same time, there are moments where they might acknowledge that they are going to be dying at some point. And even people who have experienced a loss, at some point, we may have experienced clients who's experienced a loss and they are in denial, acknowledging the benefit of having that space of being able to deny the loss for a moment, to be able to function, to take care of the children, to be able to go to work and do the things that they need to do. And we're going to talk about a grief model that really hones in on this concept of denial. It's called dual processing model. This concept of denial, going back and forth between denial and embracing the present moment. But she talks here about how there's actually a benefit in denial as well. The next one she talks about is anger. And she says, in contrast to the stage of denial, this stage of anger is very difficult to cope with from the point of view of family and staff. The reason for this is the fact that this anger is displaced in all directions and projected onto the environment at times almost at random. The problem here is that few people place themselves in the patient's position and wonder where this anger might come from. Maybe we too would be angry if our life activities were interrupted so prematurely, if all the buildings we started were to go unfinished, to be completed by someone else. If we had put some hard-earned money aside to enjoy a few years of rest and enjoyment for travel and pursuing hobbies, only to be confronted with the fact that this is not for me. And so think for a moment about the individual who has experienced a loss. They thought that they were going to have this experience with their loved one. They thought they were going to be at this job for many more years. And then all of a sudden it was stripped away from them. And they aren't going to be able to live this life with this person. They aren't going to be able to continue down this job or having this position. That can bring a lot of anger and frustration to people. So sometimes simply acknowledging our clients and what they're experiencing and helping our clients to acknowledge the anger that they might be feeling as well. And then kind of going back to the initial clientele she was focused on were individuals who were diagnosed with a terminal illness. Think about those clients.
Switch?
Oh, I'm sorry, what?
I think we had one accidentally come off mute, but I muted.
Okay, awesome, great, thank you. But yes, so going back to the other side of who the book was initially designed for were individuals who were diagnosed with terminal illness. Kind of going back to what she said, how they created this life, they had saved up all this money and thought they were going to have all these experiences, only to have it being stripped away. So it makes sense why they might feel angry, might feel upset as well. The next one she talks about is bargaining. And so bargaining, she actually couples with the concept of guilt as well. So what she says about bargaining is the third stage, the stage of bargaining, is less well known, but equally helpful to the patient, though only for brief periods of time. If we have been unable to face the sad facts of the first period and have been angry at people and God in the second phase, maybe we can succeed in entering into some sort of an agreement which may postpone the inevitable from happening. So that's related to individuals who have been diagnosed with a terminal illness, but kind of thinking about individuals who have experienced a loss and now they're in this bargaining. The way it can look is they may make comments related to it should have been this person, or why them, why me, why now? I wish it had been me instead. And so it reminds me of another workshop I had done. And the individual I had been working with in the workshop shared with me a story about his best friends from grade school. He was in his 40s at the time when I met him. And he was talking about his friends from grade school, and they were twins. And he talked about just how opposite they were. One twin became very well known in the community, very supportive in the community, and the other twin unfortunately ended up getting onto drugs and substance abuse. And he talked about how one morning he gets a phone call from their mom and shares that one of the twins had died. And when the mom first shared it, he thought it was the twin who had been on substance use because he was just really destroying his body. And so that's what he had thought. But it took him a minute to realize, wait, no, it's the other twin, the twin who works out all the time, the twin who is active in community. And he went through this bargaining place of, why God, why him? It doesn't make sense. He's the one that's on drugs. It doesn't make sense. The healthy one, the one who's doing a lot for the community, it doesn't make sense. I don't understand. And so that was an example of bargaining, asking those why questions. And so sometimes you might have clients who come and ask those why questions. And there is a narrative therapy we're going to talk about here after the break. The benefit of narrative therapy is it gives space for our clients to explore those why questions, especially for those of us who work with moms who's lost their little ones. There's a lot of why questions that pop up. And that can be challenging to work with our clients who are asking those why questions. And so also in this chapter, she talks about guilt as well. And so what she talks about guilt, she says, psychologically, promises may be associated with quiet guilt, and it would therefore be helpful if such remarks by patients were not just brushed aside by the staff. If a sensitive chaplain or physician elicits such statements, he may well wish to find out if the patient feels indeed guilty for not attending church more regularly, or if there's a deeper unconscious hostile wish which precipitated such guilt. It is for this reason that we found it so helpful to have a larger approach in our patients' care, as a chaplain often was the first person to hear about such concerns. We then pursued them until the patient was relieved of irrational fears or the wish for punishment because of excessive guilt, which was only enforced by further bargaining and more unkept promises when the deadline was passed. And so kind of relating this to individuals who's lost loved ones and they're alive and they're experiencing guilt, the key phrases here that are very helpful to reiterate to our clients is this unconscious hostile wish that the individual might have towards themselves, and this wish for punishment, or this irrational fear that they might have. This is about helping our clients to find out, where is this guilt coming from? Is it really guilt? Or is there maybe some irrational fears that they're going through? Maybe there's a punishment that they feel like they should experience because of something they did or didn't do when the person was living. And so again, working with moms, I experienced that quite a bit of moms experiencing guilt when they lose their little one. And there's quite a few people that I've worked with as well who's lost their mom or their dad, and there was an argument, or maybe they didn't have a good relationship with them, and so they have guilt. And so again, we're going to talk about some interventions that we can do to help people work through guilt when it comes up for them. But again, it's about identifying that deeper fear that they might have, or deeper idea of punishment that they think they deserve after their loss. The next one she talks about is depression. And so when it comes to depression, in her book, she shares that the second type for depression is one which does not occur as a result of past loss, but is taking into account impending losses, so this future loss. And she says, when the depression is a tool to prepare for the impending loss of all the love objects in order to facilitate the state of acceptance, then encouragements and reassurances are not as meaningful. The patient should not be encouraged to, quote unquote, look at the sunny side of things, as this would mean he should not contemplate his impending death. It would be a contradiction to tell him to not be sad, since all of us are tremendously sad when we lose one beloved person. The patient is in the process of losing everything and everybody he loves. If he is allowed to express his sorrow, he will find a final acceptance much easier, and he'll be grateful to those who can sit with him during this stage of depression without constantly telling him to not be sad. And so this one, a lot of times, is overlooked by a lot of people. Many times when we see someone who's sad, it's, for some people, human instinct to try to make them feel better, try to make them feel happy. It's something that we're taught at a young age. Oh, someone feels sad, you give them a hug. Someone feels sad, you comfort them. You share. You try to help people feel better. And so here she's saying, doing the opposite, letting them feel that sadness, acknowledging that they've just lost everything. They just lost their spouse. They just lost their child. Not only do they lose their child, but in losing their child, for some, they lose their role of being mom. They lose their role of being dad. For someone who's lost a sibling, they lost their role of being a sister. They lost their role of being a brother. So they lost a huge part of their life. And so sitting with them in that sadness can be very helpful. And there's a type of grief model that we're going to talk about, companioning model, that helps us with concrete tools to be able to sit with people in those moments of sadness. And so the last one she talks about is acceptance. And so acceptance, she says, if a patient has had enough time and has been given some help in working through the previous described stages, he will reach a stage during which he is neither depressed nor angry about his fate. He will have been able to express his previous feelings, his envy for the living and the healthy, his anger at those who do not have to face their end so soon. He will have mourned the impending loss of so many meaningful people and places, and he will contemplate his coming end with a certain degree of quiet expectation. Acceptance should not be mistaken for a happy stage. It is almost void of feelings. It is as if the pain had gone, the struggle is over, and there comes a time for, quote unquote, the final rest before the long journey, as one patient phrased it. And so here, I think it's very key when we talk about acceptance with our clients. Many times people think of acceptance as, oh, I feel happy, I feel joy. But here she says, it's not to be mistaken for a happy stage. It's more about the struggle is over. And that's the key when it comes to grief. The struggle is over. There's not a struggle happening, because that's basically what grief is. It's the struggle of, I had this person, they're no longer here. I had this person, they're no longer here. I miss this person. I wish for this person. I long for this person. It's the struggle of going back and forth. And here she says acceptance is, there is no struggle. The struggle is over. So it can be very helpful for us as supporters to understand the origination of the 5 stages of grief. Again, now there's 7 and 8, some are even more, but this is where it originated from. And so earlier I had mentioned some controversy. So when people first read this book, they took it as it was, as, all right, these are the stages. We have to experience denial, then anger, then bargaining, then depression. They thought it was linear. You have to go through each of these. And what Elizabeth Kubler-Ross did, she came back and explained, actually, that's not the intentions of what I wrote this book for. My intentions were to help people recognize that this is what some people experience. So some people might experience anger, and some people may not experience anger. Some people might experience denial and then experience depression. Some people might not experience depression. And she talked about how it's non-linear. One day someone's in denial, and 3 days later they are bargaining. And then 4 days later, they're back in denial. And then a month later, they're in bargaining again. So she talks about how it's not one stage after the other. It truly is nonlinear. And even in one of her interviews, she talks about how someone approached her saying, I think I'm in this stage right now. And she says, just forget the stages. How are you doing right now? How are you feeling? So she herself even encourages people, don't get so caught up in what stage you're in. It's helpful to be aware, but at the same time, don't get so engrossed in, I'm in anger. I want to hurt and get to acceptance that we try to skip through and try to quickly go through anger. Instead, simply just be where you are and be okay with that this is where we are at this present moment. And so that's the 5 stages of grief and where they initially came from. All right, and so now we're talking about some assessment tools. And so this can be very helpful when we're working with our clients. It helps with being able to conceptualize our cases a little bit more and identify which direction to go in when it comes to treatment, and help identify which interventions might be most helpful. And again, we're talking about interventions later on during the second half of the training. And so when it comes to some of the assessments that we're going to talk about, please be mindful that some of them are free and some of them do have a cost. And so just kind of be mindful as we're going through these. Also be aware of licensing requirements associated with them as well. And also please be aware that any such requirements before use of any assessment tools. So some of them may require additional components to it as well for grading the tools as well. And we're going to talk more about that. And so before we dive into this, I do want to pause for a second for those who might be doing telehealth. I know that's become more popular with COVID-19, but I know there's a lot of different places that are letting up. So telehealth may not be as prevalent, but just in case, if you are still doing telehealth with some patients, I always encourage, whenever I do these trainings, I encourage people to be mindful of those clients who are experiencing depression and grief to the point where their safety is in concern. So maybe they're having suicidal thoughts, or they have a history of self-harm. It's very important that if we're doing telehealth with them, that we're mindful of their location, because we might assume that they're at home, and let's say with technology, there might be a disconnect in services, or maybe we're in the middle of a phone call and it disconnects, or maybe they share that they're having suicidal thought, and we automatically think, and they have a plan, and they know what they're going to do, and then they hang up. And we automatically assume they're at home, but in reality, they may not be at home. They may be at a friend's house. So I encourage, if you have a client who is has a history of suicidal ideations and attempts and self-harming behavior, to first find out at the beginning of session where they're actually located, physically located. And another thing to keep in mind is if we do feel that we need to call 911, just keeping in mind that when we call 911, it goes to our local place where we're located at, and it doesn't necessarily go to where our client is located at. So sometimes it can be helpful knowing the local hospital's information of where our clients are at. I definitely encourage just kind of being mindful of those kind of scenarios that might pop up when working with clients who have a history of suicidal attempts and self-harming behaviors. Yeah. So we'll go ahead and dive in. We're going to first talk about BEC, BEC Depression Inventory, BDI. I'm sure at some point everyone has heard of this, but basically the BDI, it can be used from ages 13 to 80. It is a self-administered assessment, and it takes approximately 10 minutes to complete. And it's available in diverse forms, including short form. And it's also available worldwide, so it is culturally sensitive, and it may have a cost associated with it as well. So the next one we'll talk about is Hamilton, the Hamilton Depression Rating Scale. And so this is another cross-cultural assessment. And so this particular one, it measures depression in individuals before, during, and after treatment. So it's going to be very beneficial, especially for those clients who might come in who are a little skeptical about therapy. It can be very helpful for them to realize, oh, wow, I am making improvement in treatment. It also is clinician administered, and it takes about 15 to 20 minutes to complete and score. So it's not too long. It's a 21-item assessment, and it measures either on a 5-point or 3-point scale. And it's also in the public domain, so there's no cost to receive this one. The next one is core bereavement items. So this particular one, it's a 17-item questionnaire, and it measures the intensity and the evolution of bereavement experiences among a different variety of bereaved persons. So it could be someone who's lost a spouse or adult child, someone who loses their parent, or a parent who loses their child. And this particular one, it is rated on a 4-point scale, and it does fit within 3 subscales. So it focuses on images and thoughts, acute separation, and grief itself. The next one is the impact of event scale revised. And this one is actually available in a lot of different languages. So for those of you who might work with clients from diverse cultures and diverse languages, it is available. And so this particular one, it does capture many distressing symptoms commonly reported by those who have experienced traumatic grief or are experiencing traumatic grief. It's a 22 self-reporting measurement. And again, it focuses on stresses related to the traumatic event that they may have experienced. The next one is a 25-item Hopkins symptoms checklist. And this is also another one, a cross-cultural assessment. There have been several studies done utilizing this particular assessment in Africa. So it's shown across the world, a lot of great benefits. And so basically it captures many distressing symptoms that's commonly reported by those who have experienced traumatic bereavement. The symptoms inventory, it measures symptoms of anxiety and depression. And there's 2 parts. The first part is a 10-item for anxiety symptoms, and the second part is 15 items for depression symptoms. And then the next one is the Hogan Grief Reaction Checklist. And this is a lot longer one. It's about 61 items. And so it focuses on fear of loss of control, difficulty with concentrating, survival's guilt, panic attacks, and the desire to die to be with a deceased person. And so it is on a 5-point scale, and it ranges from does not describe me at all to describes me very well. And this one I definitely highly recommend for individuals who have clients coming in with panic attacks and a longing to be with a person who's died to the extent where they themselves wish they were dead. And so doing this particular one can be very helpful to give us an idea of where they are. Right, the next one is the Revised Grief Experience Inventory. So this particular one is a 22-item scale measurement, and it measures 4 domains, so existential concerns, depression, tension, and physical distress in relation to the deceased. Responses are scored on a 6-point scale, and it ranges from slight disagreement to strong agreement. And the next one is the Grief Measurement Scale. This is a 38-item one, and it assesses grief numbness and disbelief. It measures separation anxiety, sadness, and despair, and the frequency within the past week. So it's never or rarely, or 1 to 2 days per week, 3 to 4 days per week, or 5 to 7 days per week. I find this one to be very helpful because sometimes clients come in and it's hard for them to identify how often they experienced something, how often they experienced anxiety, how often they felt sad or despair. So this is going to be very helpful to be able to do this one, and then fast forward to middle of treatment, doing it again, so that they're able to see the progress of, wow, when I first came in, I was experiencing separation anxiety almost every day, 5 to 7 days a week. Now I experience it 1 to 2 days. So this can be very helpful in assessing the progress of treatment. And also we're going to talk about a couple of grief models that do embrace doing these types of assessments during treatment so that we can really see how much progress is being made with our clients. And then the next one is the pre-loss risk factor checklist for complicated grief. And so this one is more about background, the background of the individual, the death-related, bereavement-related factors prior to the loss. And the next one is the inventory of complicated grief, ICG. And this one is a 19 first-person statements, and it concerns the immediate bereavement related to thoughts and the behaviors of the client as well. And this next one is quite a bit longer one, the Grief Experience Questionnaire. It is a 55 self-assessment administered questionnaire. It does the 5-point Likert scale measurement, frequency of experience from never to almost always. And their instrument, it originally was developed to compare bereavement experience of suicide versus non-suicide survivors. And over here, there are the 11 dimensions of grief that it explores as well. All right, and then the next one is the caregiver inventory. It is important for us to check in on the caregivers that we're working with. So this particular measurement, it really hones in on how the caregivers are doing from taking care of their loved ones. It's mainly geared towards those who are experiencing dementia, but it can be geared towards, it can be adjusted and geared towards people who are experiencing grief as well. Right. And then this last part, these aren't necessarily assessments, you could say. This is more screening tools that we can utilize to see if maybe doing an official assessment would be beneficial. So the first thing is symptom snapshot. So basically this is asking our clients, well, how did your life look 3 months before the loss? What would I have seen you doing 3 months before the loss? And then finding out what are they currently doing. So this lets us know how much have their behavior changed. It's a concrete comparison of before and after their loss. And again, this helps us kind of go in which direction or which assessment we can possibly provide for them. The next one is investigate integration. And so this one is about asking our client to retell the story of the death, retell the story of how they heard about their death, or tell the story of something related to their loved one. And so what we as clinicians, what we're doing, we are looking for some incongruencies and some blocking that might be happening. So maybe our client is talking about a sad moment, but they're smiling. or they're talking about happy moments, but they look sad. So we're looking for some incongruencies, or maybe they're talking about it and they're kind of fidgeting or kind of rocking a little bit. So that lets us know that there's something happening here. There's something underlining that's going on that we might need to hone in on at some point. And then the last one is credulous questioning. There's a statement by George Kelly. He once remarked that if you want to know what is going wrong with a person, ask them. He just may tell you. So simply asking the person, how are you doing in your grieving process? How are you doing since you lost your job? How are you doing since your husband died? How are you feeling since your child died? So just simply asking them, how are you doing? And many times our clients can let us know, this is what's going on with me. So sometimes asking those questions can be very helpful and beneficial as well. And so we're going to, if I can get to it, there we go. So now we're going to talk a little bit about culture, spirituality, and development related to grief responses. And so it's very important for us to understand how culture can impact how somebody mourns. And so here I have listed a few different cultures. Please understand these are not all the cultures, of course, but I just wanted to share just a variety of ways people mourn and how it looks different across the world. And so the first one we have here is the Middle East. So some places in the Middle East, some women will come together and they will sit and they will talk about the person who's died, and they will cry together, they will mourn together. And that's how they grieve. And then others, some other places in the Middle East, when someone has lost a loved one, a person will go out to the street and they'll cry and they'll walk down the street. And others in the community or others on that same street who's also lost loved ones, they will come out to the street and they'll cry as well. And so by the time they get to the end of the street, there could be 30, 40 people crying there together, mourning. So just an example of how some cultures might grieve. In Mexico, there's a 3-day celebration, the Day of the Dead, where a lot of acknowledgement is given to those who's died. In Australia, they have the death wail. And so basically it's when an individual cries as loud as they want to express the sorrow, express the hurt, the pain, the sadness that they're feeling after the loss that they've had. In some places in Africa, they have a year where they mourn and cry and grieve and express the mourning any way they want to. And then when that 1-year anniversary comes up of when that person died, everyone comes together and they have this huge celebration of the person. They talk about the person, they go down memory lane about the person. It's just this really fun celebration with food and just fellowship with each other. And then kind of thinking about here in the US, how do we grieve here in the US? Yeah, so back in the day, here in the US in the early 1800s, it was more about how did people see us? It was more about how does society see us? So it's about what we wore. So women would usually wear black because black was a symbol of mourning. It showed respect for the person who died. And so they would wear black for months at a time. However long they were grieving was how long they wore black. And then as they were working through the grieving process, they began to wear lighter colors, such as gray or lilac or black and white together. And same with those who, same with men who maybe lost spouses or a child, they would wear black for a certain period of time. And usually for men, those more acceptable if they wore black for at least 6 months to show respect. And so fast forward to 1917, where Freud wrote Mourning and Melancholia. And this is actually where grief work comes from, the grief work model. This is where it derives from. But basically the concept is that the model stresses the importance of moving on as quickly as possible. So reintegrating yourself into life, letting go of the ties, removing all connection with the person who's died, and focusing on connecting with other people and moving on. And so if you focus just for a moment on that terminology, we hear that still sometimes to this day. It's time for you to move on, or wow, you're still not over that yet. And we're going to talk a little bit after the lunch break. We're going to talk a little bit about support systems and how important support systems are and how they play a huge role in the grieving process and how people work through the grieving journey as well. And so it's interesting, when he wrote this, a lot of people took hold of this. A lot of people really embraced this idea of moving on and letting go and keep moving forward. And then unfortunately, his daughter died. And when his daughter died, he realized this concept of moving on was actually not a good fit. This concept of breaking all ties was actually not a good fit. So at the end, he did end up changing his tune and actually encouraged embracing and staying connected to your loved one. But unfortunately, by that time, mourning and melancholia had become very popular and people had ran with it. But at the end, Freud did recognize that it probably wasn't a good fit after losing a loved one.